let me just say, Kevin, and reiterate what Michael said. Congratulations to you and to Connect for Health. I remember when I was running for Senate, when we first started running, it was something close to 100,000. I don't know what, you can tell me exactly what the growth has been in the last couple of years, but obviously COVID played a role in making it harder for people to feel comfortable and get healthcare. And now suddenly we're seeing this dramatic increase. And as Michael was describing, the importance of making these changes permanent. If we made the subsidies permanent that came with the American Rescue Plan, 4.2 million uninsured Americans would gain permanent coverage. And obviously millions more would be saved on the costs. When we first did Connect for Health back in 2013, I can honestly say we knew there was a real need there. But now to see how many people are able to afford healthcare costs, it's remarkable. When you look at the monthly cost for if you're a working person and qualify for these subsidies, you can get healthcare for less than $10 a month. And that is a huge benefit to not just that individual, but to their families and to their extended families, to their employers, because they're now going to have a better focus on their jobs. They're going to be able to not have as much sick time away from the business. All these things are true. And Michael described also the prescription drug issues. I've been noodling around on that myself, or I should say my staff has. It's lucky to have great staff. Michael being the senior senator is my mentor. And the one thing he pushed really presented in graphic clarity right from the beginning is you're only as good as your staff. And I think we both have terrific staffs. I think it's amazing that Americans pay something on the order of 3.5 times more for their prescription drugs than if you average all the other industrial developed countries. We're paying 3.5 times more. That's unacceptable, especially when you look at, 88% of the drugs, prescription drugs sold in America are generics, and there the savings is almost negligible. Whereas but if you look at it, or I got that wrong, that 88% of the money spent in the country it goes towards the newer drugs that are not covered by patents still. They're not generic. And when you take that out and begin looking at how much people are spending for their prescription drugs, it is a national embarrassment that, again, 3.5 times more. That means if somebody is spending $100 a month on prescription drugs, and think about so many people, how the rising prices, for a lot of people, that would be cheap. They should only be spending something like $30. So we're spending $100 per person per month, and it should be $30 per person per month. That's something that we'll obviously want to be able to address. Anyway, I don't have more to add. These guys covered it pretty thoroughly. I do think it's a remarkable thing to say that, in this age where 1 out of 3 Coloradans struggles to pay their prescription drugs and to be able to afford healthcare, they're worried about their monthly budget. We're able to provide something like these subsidies that dramatically improves their situation. And I think Coloradans should be, make sure that everyone's aware, because we know that there's thousands of more Coloradans out there that aren't taking advantage of this opportunity.